what happened to the CEO of United Healthcare. We now see pictures of the guy who shot him. It looks like a young man. He stayed overnight in a youth hostel. Apparently, there's some security footage and photos of that. We have pictures of his face. So, and also they've recovered a water bottle that he drank from. So, I think it's probably just going to be a matter of a relatively short period of time before they track him down. I mean, once they've got your DNA, if anybody in your family has ever registered with any of the, DNA sites or whatever, or if you've ever had an interaction with the law, or actually anybody in your family has, then it's not that hard to track you down. So this guy is probably going to be toast fairly soon. What we do know is that the bullets or the casings, the shell casings that were left behind, he was firing a semi-automatic pistol, apparently with a silencer. And the shell casings that were left behind had some words written on them. Those words being deny, delay, and depose. And there's a book titled, Deny, Delay, Defend, Why Insurance Companies Don't Pay Claims and What You Can Do About It. A lot of speculation that what we have here is somebody who himself, or more likely a member of his family, maybe a parent, was denied care by United Care. Of all the health insurance companies, United Healthcare has the highest rate, according to multiple sources I've seen online. Now, I can't personally verify this, but United Healthcare has the highest rate of turning down claims of all the companies. It's also a massively profitable company. Mr. Thompson, the guy who was shot, the CEO, makes about $10 million a year. His net worth is estimated to be over $42 million. The the chairman of their boards, Helmsley, is the guy who followed Dollar Bill McGuire. Dollar Bill McGuire left United Healthcare with $1.6 billion. He had to give back or be charged with fraud. The guy who followed him, Stephen Helmsley, took about $500 million and is still, I guess, the chairman of the board. Massive amounts of money being made by this company. And, in 2023, the last year we have full statistics for, last year, we Americans spent $4.8 trillion on health, not just insurance, but everything we spent, $4.8 trillion, which over a decade, assuming that there was no growth, and of course there would be, but if you just multiply that by 10, you get 48 trillion. So, probably if you factor in inflation and everything, over a decade, at the current rate, we're spending around 50 to 55, maybe as much as $60 trillion a decade on healthcare. Now, Elizabeth Warren and Bernie Sanders have both put forward plans that would cover everybody in the country, that would cover everything, but that would basically end all of the money going to companies like United Healthcare and Anthem and all these other companies. And so no more executives making $40 million or $500 million, no more dividends to people who own the stocks and things like that. And what's interesting is Elizabeth Warren's plan is estimated to cost $20 trillion a decade. A number, by the way, that was used against her in the newspapers when she rolled out this plan, attacked for it. Oh my God, you want to spend $20 trillion over a decade? Like I said, we're spending over $50 trillion right now. And Bernie's plan would be $32 trillion. Elizabeth Warren's plan has co-pays and some participants. Bernie's plan is just a pure single payer, and you don't pay anything for anything, and it's $32 trillion. So if we're paying $55 trillion right now over a decade, everything for everybody in the country is $32 trillion. It kind of looks like about $20 trillion a year is going to these big insurance companies and whatnot. Again, I'm just doing math off the top of my head. This interesting article by Wonkette, by Robin Pinacchia this morning, talking about the assassination of Brian Thompson and how people are just all over social media, just sarcastically, my thoughts and prayers are unfortunately out of network, or claims for thoughts and prayers are denied at this time. People are kind of cynical about it because I think we all know that we're being ripped off by these giant companies. One survey, she notes, found that a quarter of Americans say they didn't call an ambulance in an emergency because they couldn't afford it. A search, I'm quoting here from Robin's piece on Wonkette, a search for United Health Cancer on GoFundMe turned up myriad pleas from desperate people who had been told that their chemo meds were not covered or that their doctor or hospital had recently become out of network. This week, Anthem Blue Cross Blue Shield announced that they will not cover anesthesia during a particular time. I mean, this is just insane. In an unprecedented move, this is from asahq.org. In an unprecedented move, Anthem Blue Cross Blue Shield plans representing Connecticut, New York, and Missouri have unilaterally declared they will no longer pay for anesthesia care if the surgery or procedure goes beyond an arbitrary time limit, regardless of how long the surgical procedure takes. The American Society of Anesthesiologists called on Anthem to reverse this proposal immediately. Anthem is owned by a company called Elevance Health. They reported a 24% increase in year-over-year net income to $2.3 billion as of June of this year, and a 24.29% increase in their year-over-year net profit margin. But that's not enough for these greedy SOBs, and well, you get it. So, Brian Thompson is dead, and we're looking for everybody, the country is looking for the guy who killed him. But I think it raises this larger issue. Over in Democratic Underground, for example, GOP is crap is the screen name of the person who posted this. And I'm just going to read it straight through. It's only a paragraph. He or she writes, in 1987, at the age of 29, I came down with salivary gland cancer. Although it was tough and expensive, it was doable, and I was in remission. Fast forward to 1993, and it came back with a vengeance and metastasized. Because it was deemed a pre-existing condition, the insurance company, Blue Cross, denied my coverage. I amassed $197,000 in medical bills and filed for more bankruptcies than the allowable number of times in the specified period. Because I did that, declared for bankruptcy, the doctors were forced to continue with the treatment and my life was saved. But because this person filed for bankruptcy too many times, I was charged with abuse of the U.S. bankruptcy laws and contempt of the federal judicial process. I pled guilty to contempt of court and a violation of the judge's order to cease filing. I spent 13 months in federal prison. I am now a felon and did probation for 3 years. In addition, we lost everything we had. But I also negotiated in court that the bill be reduced to $11,000. 3 lessons I got out of this. 1, everyone should be on single payer you have in Europe. 2, in the U.S., you either pay with time or money. And 3, screw the insurance companies and the greedy asses who run them. So, you can read that at democraticunderground.com right now, one of the sites that I read every day and, used to occasionally post at. It's grim stuff. I want to just add one kind of footnote to my thoughts on the killing of Brian Thompson. There were these 2 young men who shot up, or a young guy. It was one guy. Okay, I'm forgetting his name. This was back in the 80s, right, as I recall. And then, like a year went by, and then there was a school shooting, and that was 2 guys. And then school shootings like 2 or 3 times a year, and now we're having school shootings like once a month, and have been for a couple of years. And it was like this trend got started of killing students. And I hope that we're not seeing the start of a brand new trend. Again, America has more guns than people. We have 400 million guns and 340 million people. I hope that we're not seeing the start of a new trend where CEOs are in the crosshair instead of school students. I do think if that were the case, if CEOs are being shot at the same rate that children in our schools are being shot, that those CEOs would be using their financial power to lobby for gun control laws tomorrow morning. But still, I don't, I'm hopeful that this is not the beginning of something new.